Hey, it's Sam. How's it going? I can't wait for the weekend. It's finally Friday, which means my husband and my son are going to be home. I'm not going to be here by myself, drinking coffee, sometimes doing laundry and doing whatever else I do all day, waiting for them to come home. So, today I want to talk about what are good questions to ask your nurses and your doctors before you get to leave the hospital. One of the most important questions or things that you need to figure out is your pain medication regime. For me, for my surgeries, I was on opioids, and it is important to maintain your scheduled dose as well as tapering your dosage so you can get off them effectively and efficiently. You don't want to just stop taking those bad boys. Trust me, that was 5 days I never want to experience again. I went through some serious withdrawal symptoms and I had to be hospitalized for it. I couldn't open my eyes for 5 days. That's not including the nausea I experienced, and not being able to vomit was the worst part of it all. So make sure you have a pain medication regime, stick to that schedule, and don't falter from it. Really important thing to work out. Number 2, you want to talk about and discuss signs of complications. For me, it was rash. It could have been a rash, anywhere. It's here, or my stomach, or kind of anywhere. So keep your eyes out for a rash on your body, a fever, or I was told to look out for abdominal pain, cramping, abdominal pain, something more off than usual. You know your body better than anybody else. So if you're feeling off, communicate with your doctor. Which leads me into the next one, is you're going to discuss your timelines for your follow-ups, whether they're going to be in person or over the phone. If you go from one follow-up to the next follow-up, say every 3 days or a week later or however long, make sure you're taking notes of the weird things that your body's feeling, or something that you're not sure of. If you ever have something that you feel is wrong, go to Emerge. Okay, it doesn't matter if you live in one town and your surgeon is in another. If you're having an emergency, go to your nearest emergency center. They will help you. They have your records. They're all connected. Which kind of leads me into my next situation. Like, the next question or thing you want to discuss with your doctor are travel plans. Now, remember when I just said that your medical's all connected? If you leave your medical jurisdiction and you go to a different one, they do not have your medical history. So I'm in Fraser Health. That's my medical district. If I went to the interior, if I went to Northern Health, they wouldn't really know all of everything I've been through this past year. Same with Coastal Health. They would only have access to one of the surgeries that I had. So discuss your travel plans with your doctor. Don't leave your country unless you are cleared by your surgeon or your doctor. Those are really important things. Something else that I asked, sorry, just hold on. Another question that I asked was if there was any advice my surgeon could give a patient, what would it be? And their answer could be anything, but I really think it's an important question to ask because it's their insight, it's their perspective. You trusted them with your life, and if they could tell you something that you're not asking, what would it be? It could be advice, it could be experience, it could be you're just picking their brain, and it's a smart brain to pick, so I recommend doing that. So other questions that are not as important as those 5 are things that you can talk to your nurse about. So things like, when can you have your first shower, or when can you bathe? Because showering and bathing are 2 different things. You need the answer to both of those. I wasn't allowed to be submerged in water for a long period of time. However, I could shower the next day. So, when can you shower? When are you allowed to bathe? Those are good questions for your nurse. Also, discussing your medical equipment and your medical supplies, seeing what you're covered for. Those are things that you can talk to your nurse about, and they will get that sorted out for you. Make sure that you have this equipment set up before you go home. When you get home, if you don't have it, like I needed syringes for my feeding tube to be able to feed myself. I didn't just have those at home, I had to make sure that they were there. I had a gravity bag for water, and it had to hang on something to come down into my feeding tube. Those are things that I needed personally. Yours is going to look different than that. So if you need anything that is going to help you at home, talk to your nurse. Either they can give you some to last until your coverage kicks in, or you have to pay out of pocket and go and get it yourself. Either way, they'll give you some to take home, and then you got to figure it out. But make sure you know what you need. Wound care. I had bandages everywhere. I didn't just have bandages, I had an ostomy bag right here. So I needed a bag, I needed syringes, I needed gauze and tape, and just a lot of things. So make sure you discuss your wound care needs and the things you need at home. Sometimes they suggest if you don't have someone to take care of you, they can bring a nurse in called home health or something like that. There's a nurse that can come to your home, either covered or you have to pay, but it is available to have someone come and take care of your needs for you, your medical needs. No funny business. And also, if you have a pick is something, it's like an IV that just goes into your arm and it's permanently there. It has a little wire that's kind of connected close to your heart. It just gets everything in you without having to stick you with an IV every 3 or 5 days. So it's just permanently there. You can never get it wet, but you can't change it yourself. You are not allowed to change the pick dressing. You do have to go in and get it all cleaned up, and someone has to do it professionally for you. It's extremely sensitive to its surroundings when the cover is off, so you have to be very diligent, very careful. You do not want that to get infected with something so close to your heart. So those are a few questions that are important to get sorted out before you go home. Best to ask your doctor. Even if you think it's a silly question, it's not. Just ask it. Any question you have, sort it all out before you leave the hospital. They're more than happy to answer it. They want you to be comfortable. They don't want you to come back. As happy as they are to have you, they want you to go home, and they want you to live a comfortable life after you leave them. I can't wait to start talking about some things that really helped me after my esophagectomy, after I suffered esophageal necrosis. I really can't wait to start talking about the specifics, because that's why I started doing this, so that I could help the next person that goes through this and is looking for some answers. But right now, I'm just kind of laying the groundwork that has to be done, that just needs to be said. So I cannot wait next week to start talking about some specific things that I did that worked for me, that didn't work for me. I'm looking forward to it. So I'll talk to you guys then. Have a good weekend. See you later.